Before you start taking Viloxazine, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication as directed by your doctor, usually once daily, with or without food. Swallow the capsules whole and do not crush, chew, or cut them, as this can increase the risk of side effects. If you have trouble swallowing the capsules whole, you may open the capsule and sprinkle the contents onto a spoonful of pudding or applesauce. Swallow all of the mixture without chewing. The mixture should be used within 15 minutes if mixing with pudding or within 2 hours if mixing with applesauce. Do not save the mixture for future use. The dosage is based on your age, medical condition, and response to treatment. Take this medication regularly to get the most benefit from it, and try to take it at the same time each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition does not improve or gets worse, consult your doctor. Some common side effects of Viloxazine Air 200 mg capsule, extended release 24 hours include drowsiness, tiredness, headache, decreased appetite, nausea, vomiting, dry mouth, or constipation. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. Remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. It's important to note that this medication may raise your blood pressure, so it's important to regularly check your blood pressure and inform your doctor if the results are high. It's also important to tell your doctor right away if you experience any serious side effects such as easy bleeding or bruising, fast heartbeat, or unusual weight loss. In the case of very serious side effects such as black stools or vomit that looks like coffee grounds, seek medical help immediately. While a severe allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as rash, itching or swelling of the face, tongue or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Before taking Viloxazine, it's important to let your doctor or pharmacist know if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions. Be sure to discuss this with your pharmacist for more details. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have any bleeding problems, high blood pressure, fast heartbeat, kidney or liver disease, or any personal or family history of mental or mood disorders. It's important to note that this medication may cause drowsiness or tiredness. Using alcohol or marijuana can increase these effects, so it's best to avoid them. It's also important to avoid activities that require alertness until you can do them safely. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications and herbal products you are using. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it is unknown if this drug passes into breast milk, so be sure to consult your doctor before breastfeeding. It's important to note that older adults may be more sensitive to the side effects of this drug, especially when it comes to bleeding. It's important to be aware of potential drug interactions when taking Viloxazine Air 200 mg capsule, extended release 24 hours. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this medication include other drugs that can cause bleeding/bruising, such as antiplatelet drugs and NSAIDs, as well as blood thinners like dabigatran and warfarin. It's important to also avoid taking MAO inhibitors during treatment with this medication, as it may cause a serious, possibly fatal, drug interaction. Additionally, this medication can slow down the removal of other medications from your body, which may affect how they work. Aspirin can increase the risk of bleeding when used with this medication, but if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Finally, some products have ingredients that could raise your heart rate or blood pressure, so it's important to talk to your pharmacist about how to use them safely. If someone takes too much Viloxazine Air 200 mg capsule, extended release 24 hours and experiences serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness. Always take the medication as prescribed by your doctor and do not exceed the recommended dosage. If you have any concerns about the dosage or timing of this medication, be sure to discuss them with your healthcare provider. It is important not to share this medication with others. Your doctor may also require you to undergo lab or medical tests, such as checking your pulse, blood pressure, and weight, while you are taking this medication. It is important to keep all medical and lab appointments and consult with your doctor for more details. If you happen to forget a dose, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and continue with your regular schedule. Don't take a double dose to make up for the missed one. It's important to store Viloxazine Air 200 mg capsule, extended release 24 hours at room temperature, away from light and moisture. Make sure to keep it in a place that's out of reach of children and pets, and definitely not in the bathroom. When you no longer need the medication or it reaches its expiration date, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.